and thank you Shifa and thank you STSP for having me here. I am Associate Professor and Head of Department at Chief Medical College Hospital, Islamabad, and my topic is ilioinguinal and iliohypogastric nerve blocks under ultrasound guidance. So I will be briefly discussing the anatomy, technique, procedure, and complications, and then lastly frequently asked questions at the end. Now about the anatomy of ilioinguinal and of iliohypogastric nerve. They have their origin from the lumbar plexus. And what is lumbar plexus? Most of you might be familiar with that. This is the lumbar at the level of the lumbar spine, lumbar vertebra, and the plexus is the back or the lateral of the nerves. So the lumbar plexus, the nerves are from the anterior primary eye of the L1, L2, L3, and L4 spinal nerve roots. Now about the ilioinguinal and iliohypogastric nerves. As you can see, these arise from the L1 nerve root. That is the anterior primary eye of the L1 nerve root. And as you can appreciate here, that also there is a branch coming from the T12 nerve root that joins the iliohypogastric nerve, and then it forms the iliohypogastric nerves, and this is the ilioinguinal nerve. So they have their origin from the lumbar plexus, and as I have already told you that they arise from the primary ventral awareness of L1 and also part of the 12th spinal nerve. And from here they run in the plane. In the internal oblique muscle and the transverse abdominis muscle. Now, after arising from the lumbar plexus, on the lateral border of the psoas major muscle, they join the same root. These two nerves, they join the same root, but at the level of the iliac crest, they are path divided. The ilioinguinal nerve, it enters the inguinal canal, while the iliohypogastric nerve, it divides into two at the iliac crest, the lateral cutaneous branch and the medial cutaneous branch. And then the inguinal nerve is by the skin of the external genitalia, while the iliohypogastric nerve, as I told you, it divides into lateral cutaneous and medial cutaneous. So the medial cutaneous branch is by the skin of the posterolateral pubic region, and the medial cutaneous branch implies the hypogastric area or the suprapubic region. And both of these nerves, they have the motor supply for the internal oblique and the transverse abdominis muscle. Now about the ultrasound guided technique of these two nerves. Now this is a diagram where you can see this is umbilicus and this is anterior superior iliac spine that is over the iliac crest. So there is an imaginary line drawn between these two, and you have to place your probe over here. This landmark also used for the landmark technique as well. But as I am telling you about the ultrasound guided technique, so I will go through that. So now here, as you can see, our patient is lying supine, and then we are using a linear probe. This is a linear probe, and the placement of the probe is, as you can see, is a line drawn between the umbilicus and the iliac crest, or ASIS, that is anterior superior iliac spine, and along that imaginary line you have to place your probe in oblique direction. And what will you get? You will get this. This is another picture. As you can see, this is umbilicus and this is anterior superior iliac spine, and the linear probe is placed here, and this is also in plane needle approach. And then you will get this. These three muscles, and sometimes you also have the iliacus muscle here, and on the side you will be getting ASIS and the iliac crest. Now the ilioinguinal and iliohypogastric nerves, they are usually found in the fascia between the internal oblique and transverse abdominis muscle. They are embedded here in the form of hypoechoic round structures. What you will get in ultrasound screen, you will get this black and white, a very black and white picture, and you have to color it by using your own aesthetics. Like this is external oblique, this is internal, this is transverse abdominis muscle. These the round structures. I hope you may appreciate it. These are the round structures. Hypogastric structures is the ilioinguinal and iliohypogastric nerves. Over here, this is the whole black shadow. It is on the bone. That is the ilium bone, and this is the ilis over here. So this is another picture, but this picture is a classical picture. If you look hard and concentrate on this, you will appreciate this and form some familiarity between this and a pirate ship. So it looks like a pirate boat. Let me show you a pirate boat. So if you look at this picture, so it looks like a pirate boat. It has 3 layers. On side there is AS, IS, the anterior superior iliac spine. Below is a peritoneum. So for the PGs actually, for the postgraduate students or undergraduate, so it is important that they should have achieved this picture on the ultrasound screen. So some procedure tips. Take the bony shadow of ASIS in the view. That is important. You have to place your probe in such a way that some part of the bone should be under your probe. So by doing that, you will be getting this bony shadow on the side, and along this side you will have all the three muscle layers. You have to appreciate them. And sometimes, yes, sometimes the external oblique muscle is not present, and just a part of the external oblique muscle, the fascia of the external oblique muscle is not present. So you have to be very careful when you are identifying the muscle layers. And of course, I will demonstrate it while during our hands-on session, that how you will start scanning. And so some other procedure tips about the nerve identification. As I have already told you, that usually the nerves are visualized between these two muscle layers as hypoechoic round structures. But if not, then what? Then you can use the technique of hydrodissection. I hope most of you will be familiar with the technique of hydrodissection. Hydrodissection is a method in which we use a few mLs of saline or water to dissect the muscles away and to reach our target. And also known as hydrolycation method. And about the needle insertion, usually we go with the in-plane, but when you get expert by performing this, you can also go out of plane. And then local anesthetic will be injected between these two muscle layers, between this fascia. While injecting the local anesthetic, always aspirate first, because there is chances of sometimes the deep circumflex artery and the vein is also there. Complications, there may be heart failure, bowel puncture, retroperitoneal hematomas, bowel hematoma, transient femoral nerve palsy, transient quadriceps paralysis. The reason of the femoral nerve femoral nerve palsy or femoral nerve block along with these two nerves is because they share the same sheath. Now this is very important for the presidents actually. They might sometimes they just ask that sometimes they just ask them what drug can we use. You can use local anesthetics. You can also use adjuvants with it like steroids. And sometimes if there is no contraindication, there is no problem, you can also use the opioids with it to enhance the effect. Then they ask that in what concentration of those will you use. If you are using bupivacaine, let's say, then you can go for 0.5% to 0.25% for this anesthetic, for the surgical anesthesia, surgical block. But if you want to use it for analgesia, you can go with the 0.125% concentration. Okay, and because this is a very limited space, not like a facial plane of like a tab long, so you can go with the 10 to 15 mLs of the drug. Now about the indication. Now in indications there is some controversy about the indication. I will tell you why. Now before going to the indication, I would like to appreciate you to appreciate this, that the area innervated by this tumor, just this area, this small area of the lower abdomen, or the suprapubic area, the hypogastric area, the inguinal area, this just little area is being supplied by this. So what will be the indications of iliohypogastric nerve block? So let's have a look. You can use it for acute pain and as well as for chronic pain. Now for acute pain, there is surgical pain. You can use it for surgical analgesia, as I have told you. The inguinal hemianopia or idiopathy, hydrocele varicose surgery, and also in combination with the T11, 12 intercostal nerves, the block for pain relief after renal transplant. yes, there may be sometimes you have to rule out the cause. There are no abdominal pains between the scardiomas there, so you can block these two nerves to rule out the cause. Now about that, I have told you that about the controversy is that some people say that you cannot perform surgery on this block. But at my center from Children's Hospital, in the, we are using these blocks to perform the surgery of inguinal hernia as well as the hydrocele repairs in ASA4 patients because they cannot tolerate spinal anesthesia and they're not fit for GA. So but how we are doing that? Because it doesn't give you complete cover to perform the surgery on inguinal hernia. So how we are doing this? We just ask the surgeon to block the genitofemoral nerve as well. How come? Well, how come they will be doing this? Now, first we perform ilioinguinal hypogastric nerve block, and then we ask the surgeon. Then the surgeon is about to manipulate the spermatic cord, or then we just ask him to inject few mLs of local anesthetic in the spermatic cord, or at the root of the penis, he can also inject few mLs that will block the genitofemoral nerve. And by doing that, we can perform, and of course, a little sedation won't do any harm.